Well, good morning, good afternoon, good evening, dear participants. We'll just wait 1 or 2 more minutes for some more people to join. I see we're already around 65 people. So in 1 or 2 minutes, we'll be officially starting our session. I see we already have somebody writing in the Q&A, Mr. Mohammed Yusuf, writing, good evening, Team Unitar. How are you all? We're doing very well. Thank you, Mohammed. It's nice to have you with us. Thank you. Okay, we're currently at 80 participants, so I think we can begin. Dear participants from all over the world, good morning, good afternoon, good evening. It's a pleasure to welcome you to this webinar, the 11th of our series, which we do every month between the United Nations Institute for Training and Research and Empower School of Health. This webinar will be on advancing global health, leadership, and governance. And we have no one other than Dr. Dennis Bruin presenting for us, which is always a great privilege for us. So therefore allow us to take just 1 minute to introduce you to Dr. Bruin, who is the director of Empower Swiss and has worked in the field of international health for the past 30 years, with emphasis on access to medicines and vaccines, equitable health financing, and health sector management. He was a former executive director of UNITAID in Geneva. As a consultant for the World Health Organization and UNAIDS, he has worked notably on issues of health system reforms in West Africa towards universal health coverage, access to medicines and vaccines, pharmaceutical regulatory harmonization, as well as improving access to TB medicine in Southeast Asia. Dr. Bruin, as always, it's a pleasure to have you with us. I will simply share the screen right now to open your presentation, and you may begin whenever you're ready.
Thank you very much, Daniel, and thank you all participants to be here with us this morning. This session is on a very specific subject, which is actually a difficult one, this issue of global health leadership and governance. And this is going to require from us that we define some of the terms. And probably the most difficult one is to defining what is global health. Next slide, please. Well, you know, there are people who have made very complex definitions of global health. The first one from the UK is actually pretty good, but it has a lot of words in it. And it says that global health addresses issues that are beyond territorial boundaries, beyond borders, and then beyond the capacity of individual countries to address them alone. So this is an important definition. There is one in the US which is concise, but actually not very clear, saying collaborative transnational research and action for promoting health for all. It's not bad. What we would say probably is global health is how we can help the population. Can we address issues of health in the populations globally and not in one specific territory? And when we say addressing health, it is research, it is study, it is solutions, it's implementations of solutions, where the idea is to improve health and achieving equity in health for all the people worldwide and not only for one specific population. So let's try to go a bit further on this definition of global health, because it's going to be central to what we're discussing now. Next slide. So, next, please. We're saying this is study, research, and practice that places a priority on improving health and achieving equity in health for all people worldwide. What's important is that this concept emphasizes on transnational issues. We have had, of course, one example that you all remember, the COVID issue has been a global health issue, but there are several others. And we have in health a concept also which goes beyond the medical community. And we're looking at interdisciplinary collaboration. You know, for instance, this concept of One Health, which considers not only the health of humans, but also these of animals and of vegetables, because this is a determinant of global health as a whole. So this is what we have to look at. It's something, global health is where people are interconnected, interdependent, where there are determinants of health which play a role globally, not in one single country or region, and where it's not individual governments that can address the issue. It has to be addressed in a collective way. So in the next slide, let's try to see what's the difference between global health, international health, and public health. Now, clearly, in the reach, when you speak of public health in a country, you speak of one country. When you speak of international health, usually you say, okay, how can we cooperate from one country with another to improve health in that particular country? When you look at global health, you look at how is it possible to focus on issues that address health of trans borders for the whole population of the world. And when it comes to the consequences of that, when it comes to cooperation, for instance, global health requires global cooperation, requires all the countries, all of the institutions to work together, which is not the case for international health or public health. Global health is going to embrace both prevention and care in populations worldwide. International health would do that in a specific area. When we look at access to health, in public health, which is a country-specific approach, it will be how can we have better equity, better care for the population of that country. In international health is how can we do that in countries usually of low and middle income with the support of funds for richer countries. In global health, we're looking how is it possible to get equitable access for everyone on Earth. And you remember that during the COVID era, one of the major issues has been that access to vaccines, for instance, has been for a long time reserved to the rich countries. And this has hampered the appropriate work on COVID worldwide. And then definitely global health has to be interdisciplinary. There has to be things that go beyond health sciences. I discussed earlier about what it is, this concept of One Health. It is absolutely essential when we speak of global health. Next slide. Now, why is it important, global health? The big thing right now is how can we prevent or better address the next pandemic, because there will be a next pandemic. It's about keeping all the children on Earth alive and not some. And actually, this is something which has worked. When we looked at the globalization of immunization, for instance, it has allowed a drop in infant mortality or under 5 mortality by more than half in the last 30 years. It's supposed to take care of the animals, and you know that the deadliest animal on Earth is the mosquito. It's much, much worse than any other animal that you can interact with. And what we see is when we don't address these issues of mosquitoes, it comes back to haunt everybody. Indeed, there is more malaria today in Africa than there was 10 years ago, but we start seeing indigenous malaria in the south of Europe, as well as indigenous dengue, for instance. And no one is protected from mosquitoes unless there is a global approach to mosquito-borne diseases. Same goes for family planning and population issues. Same goes for eradication. You cannot eradicate a disease unless all countries on Earth want to cooperate to eradicate it. So all these elements are there. And you know, when you look at the last line, that one of the biggest global issues is how to address the health consequences of climate change and of pollution. This is not something that happens only in one country. You may address pollution in one specific place next to a specific plant, but you cannot address the consequences of climate change unless there is an international cooperation, a global approach to address it. Next slide. So why is it that we are looking at global health now? We cannot address the issues that are coming to us today without having this global approach. And then we can say, why should we look at having global cooperation when we cannot, for instance, stop the growth of chronic diseases or non-transmittable diseases in low and middle income countries? The problem is that there has been a lot of changes which have gone with globalization, for instance, and with international travel. Globalization has made epidemics of a global nature when they were local in the past. Increased travel is the same thing. You have seen that you can have a COVID in one place, but anyone who is sitting in a plane and is going to go to the other end of the world in 12 hours is going to spread it there before even it has been appropriately addressed in the place where he started his trip. So all these things make the concern about global health absolutely essential. And the problem is that we do not have a mechanism to address global health. We don't have one single organization. There are plenty of different global agencies. There are some global health players. You have organizations. You think of UNAIDS working on HIV worldwide. You think of medicines for malaria, for instance, addressing the issues of treatment and prevention of malaria worldwide. But people who work on global health, there is no one single authority, as we're going to see in the future when we look at this leadership. Next slide. Big question. Who is in charge of global health? And the answer, unfortunately, is nobody. It's not funny, but it's the reality. There is a World Health Organization. It has a mandate to help determine global health policies, but actually it is not a global health authority or a global health leading organization. It is actually, the reality is that global health is fragmented across many agencies. There is one in particular that I mentioned for HIV. You would have, an organization for TB, Stop TB, tuberculosis. You would have some, fragmented organizations looking at issues globally, and each of them claiming that their issue is more important than the others, so that they can have access to more funding than the others. This is a problem, and there is a need to have some form of a leading agency. Someone has to lead the agenda that would drive, the equality in healthcare, recognize the health disparities, but also be ready to prepare the research, the prevention, and the cure for global issues. For the moment, no one is really in charge of global health. Next slide. So if there is nobody in charge, then who is the leader? And that's actually exactly one of the problems. We have new issues for global health. We know that. We know that globalization has helped in global health. For instance, medicines, especially generic medicines, are much cheaper now than they were in the past because they are manufactured in lots of countries and they are globalized. Recently, the United States found that 80% of the active substances that they use for medicines in the US Army come from China. You know that a lot of the medicines that can be available worldwide come from places which are very different from those where they're used. Antiretrovirals, which are used in patients with HIV in Africa, come nearly all from other parts of Africa, other parts of the world rather than Africa. And the problem is that one has to move in terms of health from the nation-focused approach. The country X has their health policy, or there is an international cooperation between one rich country and country X. The question is, how is it possible to make it global? It's not country X any longer, it's the overall world population. And the terms that we're using have to take this in consideration. So that means when we are speaking of global health leadership, we need to have people who understand this concept, that understand the importance of having science, evidence, whatever is known, being able to convince authorities worldwide so that there can be mechanisms to change the nature of disease worldwide, and not only in one country, in one pharmaceutical company, in one laboratory, or even in one continent. Next slide. So there is definitely a need for leadership. And we saw before COVID that many health systems were already in a difficult situation. Was it crisis? Was it sometimes worse? Was it concern? But there are a whole set of elements that were making health systems more fragile, more difficult to manage. Aging populations, non-communicable diseases, not enough staff and people qualified to take care of public health, but also take care directly of patients and healthcare. And a whole set of reasons linked to insufficient funding for health systems. So these questions were there and were already before COVID, because COVID has been what has evidenced the importance of global health. They were there and the systems were fragile. And we have seen that COVID has exposed these frailties even more than before. So there's definitely a need to transform healthcare systems and the way they are delivered so that they have health systems which are resilient, which are strong, which are sustainable, and which provide equitable access to health. To get that transformation, there's a need for leadership, absolutely. Next slide, please. So how can there be leadership if we don't have a global governance? I mean, it's actually a complex question. Huh? And look at the box top right. The notion of governance goes beyond the formal mechanisms of government and refers to the totality of ways in which a society organizes and collectively manages its affairs. So governance is not government. We know that in public health governance, there's a need to get populations directly involved. There is a need to get non-governmental organizations. There is a need to get a consensus among scientists. There's a need to get the best possible evidence. So all of these aspects are there to have a global health governance. And there is no real definition of the term global health governance, but in general, we are looking at a set of organizations, institutions, and processes that would correspond to the mandate of global health. For instance, the World Health Organization. Next slide, please. So, sorry, these are too many words, but they are important. The international architecture for global health is complex, but it's absolutely clear, and unfortunately, very often driven by political motives. There is interdependence. Otherwise, there is no approach to global health. It's absolutely essential, and global governance must be interdependent. And that's why it has been so difficult. And everyone agrees it's important, and there is very little agreement on how to do it better. You know, global health governance is talking about institutions with an explicit health mandate, such as WHO. But we also know that it extends to a lot of other organizations that have a direct and an indirect effect on health. There is definitely the UN, but not only the UN. I mean, we think of UNICEF for child health, but think also of the food, the FDA, the FAO, Food and Agriculture Organization, for all the issues of access to food and animal health. We have a whole set of organizations, for instance, the Population Fund, but also organizations which have a major impact on how the world economy is organized, like the World Trade Organization, the International Monetary Fund, the World Bank. All of these players have a major role to play in global health. And although they talk to one another, their structures of governance are not coherent, not interdependent, and sometimes even going against one another. Next. So global health is, how is it possible to use formal and informal institutions, how to have rules and processes by which the states, the international organizations, and the non-state actor can deal together with the challenges to have that require, cooperation that works effectively. It's a difficult issue, and you will see in the three circles there a kind of word play, but which is important. Global governance for health is not the same thing as governance for global health. And it's not the same thing as global health governance, although it's relatively low. I will let you look at these subtleties on the slide, maybe after this conference, because there are a lot of interesting approaches for the brain to look at these different concepts. Next. What is very important is, can we look at the leadership, and how can we look at the leadership? And why do we have to look at it now? We have to see how to manage global health crises and to prevent them, to address them, to treat them, to manage them as well as possible. And think of how various countries have addressed COVID, how various national leaders have addressed COVID. And you will remember how incoherent and sometimes ridiculous things have been. So one would want to see, is there something that we have learned from the COVID pandemic? It's definitely that there must be a new generation of public health leadership and authority. people who are trained, respected, managed, and who can have an impact on all communities worldwide. You certainly do remember the interactions between President Trump and Professor Fauci in the United States, and seen how sometimes the negation of science, even the negation of facts, has driven actions in the COVID epidemic, which have had a very high cost in terms of human life and in terms of progression of the epidemic worldwide. So it's very important to have some form of leadership and authority, which is indeed respected, for which facts, evidence are the main determinants. And this is difficult because we are going to have more public health emergencies in the future because of climate change, because of more urbanization, because of the problem we see now of scarcities of food, because problems of access to energy, the whole issue of the environment, the lack of forest, the lack of clean air, etc. All of these aspects have to be addressed in the best possible way. And for that, there must be public health leadership. And this public health leadership must be based on facts, on science, and must have the capacity to communicate in a way which is credible for populations and for political leaders as well. Otherwise, it's going to be like looking at the train passing by without being able to change its itinerary or stopping it. Next slide. So what we know is definitely global health is lacking leadership. We have a need for this leadership to secure oversight, monitoring, evaluation, but also, as you heard before, study, prevention, action. All of these elements for global health leadership are missing. So the result is that decision makers, political leaders, etc., see that gap in leadership and tend to have reactions and decisions which are not coordinated, which are not global, and which sometimes can worsen the issues. So it is absolutely essential to have better coordination, better capacity, and for that there must be leadership. What we have seen is that misinformation in Africa has been a problem. And I would say that if I'm speaking of Africa because we see here the question of African leaders, problem of misinformation has been much worse elsewhere than in Africa. But that is true when it comes to supply chain, which is something that we work on all the time. There has been a lot of false assumptions that there was not enough supplies when it was there, that there were supplies when they were not available, that the problem was pure logistics, and then providing vehicles would change everything, which was definitely not the case. So what can help uncover the real issues? And what we're seeing now is an African capacity building, which is coming to empower the public health leaders with the African CDC, for instance, which is now starting to play a major role in providing appropriate information, research, etc., on global health in Africa, which we're seeing with various organizations, for instance, the health authorities in the African Union, etc., the onset of what will be the African Medicines Agency. All of these are training new leaders, creating new mechanisms that can drive solutions and that will indeed address the issues of supply chain that we are seeing as being major obstacles in appropriate global health in Africa. Next one. The question is how to get leaders. And this is not a simple one, but it's an essential one. You don't have leaders who are born leaders. You have some people who are more prone to becoming leaders than others. You have some people who have indeed an innate capacity to better lead the others, who are ready to take responsibilities. But you are not born a leader. You can become a leader and become an effective leader. And this is absolutely essential. You have people who indeed are born with this ability to inspire others, but for most of the leaders today, it's something that they learn. This is a skill that people can learn. And there are a lot of people who can become leaders in global health, because they have learned how to become leaders. I know scientific studies shows that leadership may be 30% genetic, but 70% of it is learned. And I would even question the 30% genetic, because I'm sure that a lot of the behaviors and the approaches of leaders can be grown in individuals and can lead in leadership, including in global health. Next one. So in a sense, you cannot have, that people speak of the difference between leaders and managers. Actually, leadership and management just go together in nature. Leadership skills are not innate. They can be taught. They require a lot of work, adult learning approach, focus, importance of appropriate mentoring. Leaders have to be mentored, have to be supported. They cannot suddenly decide, now I am a leader. They have really to be groomed in getting to that level. Good governance in global health. They have some established policies, but a lot of them are not appropriately implemented in a large way because of lack of leadership. And so we are going to need to have a new generation of leaders who will be systematic, who will be strong, who will understand the importance of interdependence and of action, coordinated action. And these are the ones who we hope are going to grow rapidly today. Let me come to some practical aspects of it. Next one. Next slide, please. How do we grow leaders? As you know, I'm director of Empower. We are looking at the issues of public health through the issues of supply chain in developing countries, especially in Africa. And the backbone is actually the central medical stores there. How do you get your medicines, your vaccines, your equipment, your supplies for the health system, and how do they work well? What we have seen is that when they are just only in the public sector, often it is not sufficient. And one of the things that we have set up has been supply chain leadership. And this supply chain leadership is something which requires a coordination and cooperation between public and private sectors. And we have seen that public sector leaders in supply chain gain to be supported by mentors or coaches from the private sector. From there, people who are managers, who are would-be leaders, can become real effective leaders. And there has been a whole set of programs of leadership for executives in public health and in supply chain that we have set up with a whole set of organizations like the CEO Forum in Africa, like INSEAD, like a whole set of private pharmaceutical company. And setting mechanisms of training in leadership, of coaching for leadership, And after that, peer-to-peer support of leaders. We have seen that this is how you can grow leaders in health in Africa. Next one. Absolutely essential is mentoring. You cannot decide to be a leader just by yourself. You need someone who can help. And we have had a whole set of CEOs of large companies, heads of mechanisms of departments of pharmaceutical companies who have accepted to become mentors for leaders in public health. This is something which is essential. This is something which has happened not only for leaders in general, but in particular for women in leadership. Every year we organize a leadership forum for women at the Galien Forum in Dakar, where a whole set of women leaders are identified and are groomed and put in coaching and mentoring programs so that they can become a real leader in their field. And we have seen that using mentoring is essential. Next slide. Why is it that important? Sorry, next slide, please. One can build in every area. What is important is that people are supported in their daily activities after training in leadership, that they are supported in day-to-day activities on how to behave like real leaders. How can they be helped? How can they be groomed into behaving like leaders? And we have seen that classroom activities is not a bad thing to learn some elements of leadership. But the reality is, how can the learnings be applied in the day-to-day life with the support of mentors who are going to help improve the performance of the leaders, and in our case, leaders in supply chain. Next slide, we have seen that this works. Definitely, it works well. We have seen that people who did this leadership training, support by mentors, had a real effect, and that the way they behaved, the way they managed, the way they led the organizations they were working on was completely different after this support by mentors. And it's not only for the top people that leadership training is important. It's actually for a lot of people who are in middle management, how they can become better at their work, be more responsible, be better in interaction with others, be better focused on results and on the way to obtain them. And we see that we have been able to build leaders in the field, in supply chain. Next. So what you see is that even in supply chain is one thing, but what we see is that this tendency of growing and grooming new leaders and getting them mentored and supported is going to help to create the leadership skills that are necessary in global health. It's absolutely essential. Global health will not fall from the top. It is going to require leaders at every stage of the health systems who have this sense of cooperation, understanding their responsibility and their role to participate in global health. I repeat, leadership skills can be learned, and leadership training in global health is absolutely needed. It has to be focused, it has to be well done, and it has to be mentored. There's a real importance of mentoring there. Slides will arrive at the end of that. You're going to see these slides yourself better because it's easier to read them when you're looking at them individually rather than on the screen now, because they're not simple. But what we see is that there are a lot of problems of inefficiencies and unethical practices that happen, for instance, in supply chain, which are enough to derail any process of appropriate public health, including in the context of global health. And it's absolutely true that to address these issues of global health, where every effort, every amount of money is going to have the best possible efficiency, this can only happen with the appropriate training in leadership and local governance. Next one. So what is good governance? It's essential. We need to have good governance in healthcare, and not only in global health, but in every aspect of healthcare. Health is essential for economic growth and sustainable development. If you want to look at the United Nations Sustainable Development Goals, you will see that health is there nearly everywhere. It's essential. But when you have bad governance, you have corruption, you have violence, you have bad economic conditions, you have, counterband, bad procurement, etc., then you have a situation that comes from bad governance. It's not only bad governance, but indeed it is the main factor that creates economic and social chaos. So it's really important to have good governance. And this is the last thing that I say. Governance is definitely managing resources and affairs of society to promote the well-being of its members. So that's important. It's not only health, it's in general good management of resources and affairs of society, as well good management of people. You cannot tell the government that they must have good governance. A government is sometimes problematic, but you can understand the importance of good governance. You can become a leader at your level and behave ethically, promote good governance by yourself, and have an impact on how governments are going to change, and also how global issues are going to be better addressed. Well, I've spoken a bit too long, and I think I will now let you take a break and be ready to ask some questions.
Thank you very much, Dr. Bruin, for this very insightful presentation. I'm sure that we all learned very much regarding good governance and also leadership, and especially within the framework of global health. So thank you very much for this. And I'm sure that we will be receiving many questions in the Q&A shortly. We've already received a couple of positive remarks from Mateso, Fida, Paul, Agape, and Lulu. So we'll be answering those shortly. In the meantime, dear participants, I will be putting a poll for your perusal here on the screen, which will help us simply understand a little bit better a bit about your background and a little bit more about yourself. So in the meantime, please feel free to address this poll while also writing your questions in the Q&A that Dr. Bruin will be answering live. Thank you.
Well, I'm seeing some of the questions. They're very good indeed, and I'm impressed that this is a topic that is something which you're looking at very clearly. speaking of managing global health crises is preparedness and communication. Well, absolutely. And we have now, after COVID, a set of tools and a set of intergovernmental discussions on how to be ready for the next pandemic. So pandemic preparedness is something that a lot of people are working on. I think in terms of science, in terms of understanding what is required, how it should be placed together, there is some form of consensus. The question is, how can this be indeed implemented by every country? When you have situations of acute war, as you have now in Europe or in the Middle East, the decisions and the funding which are necessary to implement conclusions on pandemic preparedness, on global health issues, tend to be put on the back burner. And this is an issue because we know that they are indeed very, very important. I have seen, can there be, I've seen this question from FIDA, should there be, more resources? And definitely, it's definitely there is that. Is there a supportive organization policy? I'm afraid not. There is quite a bit which is happening between international organizations, but I'm not sure that we are seeing what I was describing, which would be global health governance. It's not the case. I'm trying to see what questions I have not answered. It's clear, and I agree with you, Paul John, that there is a need for people to set aside their individual country questions to also address issues of global health. It's not drop everything else you're doing. You absolutely have to work on each national health system as we work with issues, for instance, of supply chain at the district level. These are absolutely essential elements. And you cannot build a house without having bricks one by one. But at the same time, your house is not sufficient. And this international global dimension is definitely something which is missing. We see committees, we see pretty good work done, but we don't have this global health leadership as such. And there is no real international governance that would make this global health leadership work correctly. Trying to see, have there been new questions that I have failed to say? You say, can there be mentorship for people who desire it? Well, actually, Empower does provide coaching and mentorship. That we do that within our courses in supply chain management, and we do that just as a pure mentorship as such. We have to do it within a context, and this context is the courses that we deliver on supply chain management. What are the essential characteristics for leadership in global health? Well, I hope I have talked about it a little. We have two different answers to that. One is, how do we grow leadership in health systems management? We see that for public supply chain, but we have to do that for a whole set of other topics. At the same time, what is the issue of leadership in global health? Can there be an organization worldwide that would have the capacity to provide leadership that political leaders would want to follow? This is a different story. For this leadership to be able to emerge, you would need to have some form of governance where everyone would agree to bring their knowledge, their science, their experts, their interest and their funding to a global health organization. And then there would have to be a recognition, acknowledgement of this global health leadership. We have seen during COVID, it has not been the case. We have seen that some countries have not had action supported by science. We have seen that there has been no consensus, and we have seen the noxious effects of a lot of social media who have been spreading false information, spreading opinions and presenting them as facts, etc. This is difficult. We know that these aspects, and several of your questions have been dealing with the issue of communication. This issue of communication is indeed a difficult one. And we have seen during COVID that communication can go against appropriate global health measures. Now, when you see the questions, how will global health leadership be achieved in Africa with a shortage of health workers? Well, actually, there's much more need for leadership, so that whatever resources are available are used in the best possible way. When you have a shortage of health workers, it's even more difficult. What I used to teach in public health, saying that experiments in public health can be done in rich countries, and there can be failure, and you can go back. The cost of failure in a poor country is much higher. You cannot accept to fail because you don't have the resources to come back to where you were and restart again. So the need for leadership and the need for this strength and the best possible management is much higher in countries with few resources than in rich countries. Doesn't mean that you shouldn't have leaders in rich countries, but certainly good leadership in resource-poor countries is much more important. Now, a question about can there be a plan for good governance in supply chain management? You have two elements there. You must have the best possible organization, the best possible tools, the best possible leaders. Now, after that, if you have a government that does not provide sufficient funding, or that has mechanisms that, let's say, encourage or tolerate corruption, this is going to be a limitation. But you can, with appropriate leadership, do the best with whatever is available. Yes, you can have access to training in supply chain. You will have the elements about it. Definitely, mentoring is important. We organized for supply chain leader coaching and mentoring in several African countries, both in English and French, and we have seen remarkable results with it. This is something that we organize within our training in supply chain management. Sorry, Mr. Dharni, I'm afraid I don't understand your question well. The leadership is something which doesn't have to be at the top echelon. It's absolutely everywhere. And this is something that can be taught, that can be, you can learn good leadership. You can become a better leader. And having appropriate coaching and mentoring is essential for that. I agree that the governments are the one who pass drug or medicines regulations, and there is a key governance about it. On the whole, I have not seen any countries which would have bad drug regulations. The difficulties are in implementation, be it in fighting poor quality medicines, fighting counterfeits, and also in poor procurement and poor supply chain management. But on the whole, drug regulations nearly everywhere are of decent quality. Now, this is a question for you, Daniel. Will there be a certificate of participation? This is something
on request, yes.
Are there specific questions that I have missed? And please don't hesitate to ask them again, because I'm afraid that I may have missed some of your questions. I feel sorry for it. Tell me. I have to see that these questions appear on my screen, and not always together at the right time. So if I have missed some of your questions, I really apologize.
Oh, indeed. Thank you very much, Dr. Brun. It looks like you've answered every question that's been sent to us. Perhaps we'll take this opportunity to take one last question, as we have 2 minutes left. So please feel free to type the last question in the Q&A, after which we will be parting.
So we will send everyone who participated in this information about the courses that Empower produces. The questions are coming. Can the slides of this webinar be sent to participants? I'm sure is the case. Daniel will confirm.
Yes, that's right. We'll be sending the slides of this presentation, as well as some more additional information on the courses that Dr. Brun mentioned.
The question is good. Are some people who are destined to be leaders, or everyone has the same opportunity to become one? There is one movie which came in the 70s, where a choreographer tells a woman who is dancing very badly, and telling her, "I'm not going to make you a great dancer. I'm not even sure I'll make you a good dancer, but I'll make you a better dancer." And this is what you have with leadership training. You may not become the best possible leader, but to become a much better leader. And this is essential. Better leadership is something which produces a lot of results. And it doesn't have, you're not going to become the Minister of Health, the President